This video will cover T-cell histiocyte-rich large B-cell lymphoma. To anchor ourselves, we have an image taking place at a historical Taco Cell fast food location. The fact that this location is historical will represent histiocyte, and since the name of the restaurant is Taco Cell, that will represent T-cells. The mean age is 40 years, which is represented by this character, which looks to be right around that age. Due to the inflammatory nature of this tumor, we need to differentiate it from nodular lymphocyte-predominant Hodgkin lymphoma. To remember that we need to differentiate it from NLPHL, we have a billboard here for the NHL. NHL and NLPHL sound similar, and that is what we will use. One of the unique findings of NLPHL compared to it is that, of course, NLPHL has nodular architecture, and T-cell histiocyte-rich large B-cell lymphoma does not. This is easy to remember since nodular is literally in NLPHL's name. Another way to differentiate these is that T-cell histiocyte-rich large B-cell lymphoma lacks CD21 follicular dendritic cell meshwork. This is represented by our Tweety character, which represents 20 since they sound similar. And since this Tweety character is only thinking about a 21 plus beverage but does not currently have one, will remind us of negative CD21. The last way to distinguish T-cell histiocyte-rich large B-cell lymphoma from NLPHL is by an absence of CD57 positive T-cell rosettes. These rosettes are present in NLPHL and are another way that we can distinguish these two tumors. To represent CD57, we have our main character wishing he had a frisbee from heaven. Frisbee represents 50 since they sound similar, and the fact that this frisbee has a halo and is from heaven represents the number 7. Since heaven and 7 sound similar. So we'll use all of this to remember that these patients typically lack CD57 positive T-cell rosettes. T-cell histiocyte-rich large B-cell lymphoma involves the marrow as paratrabecular lymphoid aggregates just like follicular lymphoma. This is represented by this pair of green trombones. The fact that there is a pair represents para, trombones represents trabecular, and finally, since they are green, this represents lymphoid. Next, and lastly, we need to talk about how BCL6 is usually expressed in these. This is represented by this character being held in some type of belt made of sticks. Belt represents BCL since belts have buckles, and buckle is similar to BCL. And the number 6 is represented by these sticks since they sound alike.